So let's move a little bit to the degenerative ones. And where are you right now in the development cycle for drugs for those Alzheimer, Parkinson's, IBD, and autism under one umbrella, I guess, right? Is that what you call a GBA disorder? Did I get that
Yes,
right?
yeah. And so we're getting ready to initiate phase 2 programs. So those are kind of mid-stage clinical studies in Parkinson's disease. And with that, we are also measuring sort of those irritable bowel syndrome endpoints, which I think is really important because then it really keeps us on a critical path towards a more rapid approval. So this is like where the strategy comes into place. You can get a approval just on the basis of the GI improvements, right? So we can get this out to patients, and then you can have a longer term study going on for like the motor, non-motor, and cognitive improvements. So it is a rapid path because we don't really want to be in one of these situations where you say, hey, here's some hope, but not for you, right?
That's right.
For
That's right. That's right.
people behind you. And that's been one of our, again, one of our big strategic pillars. And then on that basis, we'll be expanding. There's also an IBD study that's ongoing in pediatric and young adult patients. And, autism is one that I think there's a profound interest in. And, the way we'll also go into that is, and this will likely be staggered to the adult study. We still need to meet with the regulators because they always like to see adult data before you go into kids, but luckily we have the pediatric IBD study, so I think that can accelerate our move into autism. And what's fascinating about autism, and it's really near and dear to my heart, having served those families and worked directly with kids that could benefit from this, is the most common comorbidity is GI issues. About 80% of the children are constipated, and where these compounds would be, that alone is a profound improvement and will absolutely improve behavior as well, especially in children that have challenges communicating. The other aspect I think that's interesting about this is children with autism have palatability issues, right? As it pertains to diet, and there's also aspiration. So they have trouble chewing, and they also often kind of choke on their food. And so these compounds actually taste good, and they readily mix into water. And because it's not a living organism, aspiration risk goes down, right? If you aspirate a bacteria, you're in trouble, right? It leads to pneumonia. But for these compounds, you don't have it. And it also can just, again, mix into the most easily, a smoothie or something like that. So I would say that, we are looking to also engage our regulators to talk to them about this, because one of the fascinating things is that these compounds are generally recognized as safe to be included in infant formula today. Again,
it shouldn't be a stretch basically to get an approval. Is that what you're saying? You already approved it.
Yeah. So there's an opportunity to advocate for pragmatism in the regulatory paradigm, to discuss a standard that will be sufficient for physicians and patients to make, again, educated decisions and give good informed consent. But then we also need some pragmatism in terms of, the moment we're able to show benefit with effectively no risk, which almost no drug has ever shown, how can we collaborate to advance these much more rapidly? And so, so that's really kind of the roadmap.